Hi guys, welcome back to my YouTube channel. My name is Jane, a registered nurse midwife. So today I'm going to be bringing us a health topic. Sorry, this it's a condition a lot of pregnant women go through, and some of them don't even know why what is happening to them is happening. And statistics has it that 1 out of 5 women undergo this condition. What is it? It is known as pelvic girdle pain. Pelvic girdle pain. Pelvis has to do with your waist area, and then girdle, pelvic girdle is more like a bony structure that goes round your body at the base of your spine in the waist. So during pregnancy, a lot of women undergo pain. They experience pain in this pelvic area, and some of them don't know why it is happening. Now, this condition is a collection of uncomfortable symptoms caused by either stiffness in your pelvic joint, that's the joint in this pelvic that I talked about, or the joint moving unevenly either at the back or at the front of the pelvis. I'll be attaching pictures to aid your understanding of this. Now, when we are talking about pelvic girdle pain, we're talking about pain in the waist region for pregnant women, because what I am focusing on is pelvic girdle pain in pregnancy. So for pregnant women, these women undergo pain in their waist region. Now, how do you know that it is pelvic girdle pain that you're experiencing? You have pain on your pubic bone. I'll be attaching pictures too so that you'll be able to identify what I'm talking about. Pain over your pubic bone. You have pain across your lower back. You have pain in the area between your vagina and your anus. That's the perineum. You experience pain there. You may, because one symptom in one person may not be the same as another. Now you have pain while spreading your thighs. When you want to spread your thighs, you may experience pain in your waist region. You may experience increased pain on walking. Remember, I'm talking about pregnant women. You experience increased pain on walking when you want to walk, when you want to take the stairs up, when you want to turn over in bed, when you want to move your legs apart. All these things, while doing all these things, you may be experiencing pain in your waist region. Now, the pain ratio differs in different women. Some of them experience a mild pain that may not be of obvious interruption in their daily activities, while others experience it in a huge way that it may interfere with their daily activity. So each woman for her own experience. It is not generalized. Now, how do you treat pelvic girdle pain? The truth is that whatever treatment option you may be given, the pain may not completely go away until your baby is born. This is because the weight of the baby, the position of the baby contributes to this pain. The weight and position of the baby contributes to this pain you're experiencing. But one thing there is to diagnose it early, to diagnose that it is actually pelvic girdle pain that you're experiencing early in pregnancy. And when this is done, you may be referred to a physiotherapist that may give you other treatment options to undertake, like exercises to help strengthen your pelvic muscles, exercises to help strengthen your lower back muscles, exercises to help strengthen the muscles in on your stomach and on your hip. And then for some, they may be referred to equipment for support, like the clutches. You may be given pregnancy belt or pelvic support belt, the one we know as pregnancy belt. I'll still attach pictures so that you can see what I'm talking about. So these are the treatment options that may be given to this woman who is experiencing this pelvic girdle pain. Now, remember I said that no matter what treatment option you're being given, the pain may or may not go away before you deliver your baby. How do you now cope? What do you do to help yourself? Now, keep active, be active, but don't carry out activities that increases the pain on your waist. Do not sit or stand for so long at a time. Don't sit at a place or stand at a place for over 30 minutes if you're a woman who is experiencing this pelvic girdle pain. Now, while you're sitting down, do not cross over your legs. It puts extra pressure on this your pelvic region. Next thing is rest. Ensure that you rest. Ensure that you rest. When you want to turn over on the bed, please put your knees together and do it gently. Don't keep your legs apart. It will increase the pressure on your waist area. It will increase the pressure on your waist region. Wear supportive shoes. There are some shoes that are supportive. I will attach one to this video so that you can see an example of what I'm talking about. Wear shoes that will support your weight and the weight of your baby. Now, while you're standing, balance out your weight on both legs. Let the pressure you're putting on one leg equate the pressure you're putting on the other leg. Then don't carry heavy things like grocery bags. You go to market, you're having this pelvic girdle pain, you go to market, you're still carrying heavy bags, you're still struggling with heavy bags, and also while having your pain, it is a scenario that will increase the pain you're experiencing. Now, while you're carrying out any activity, I encourage you to sit down and do it. If you're dressing up, sit down and dress up. If you're undressing, sit down and undress. Remember I said don't sit at a place for longer than 30 minutes and don't stand at a place for longer than 30 minutes. Just keep your body moving, but don't move in the direction that will increase the pain you're experiencing. Now, keep your knees together when getting out of a car. Keep your knees together. Remember, as I said, when turning on the bed, keep your knees together. When getting out of a car, keep your knees together. Avoid crossing your legs while sitting. Now, you may ask, people who experience this pelvic girdle pain, will they still undergo vaginal delivery? The answer is yes. That you're experiencing the pain does not mean that your pelvis is not adequate. The only thing that will make them consider CS as an option for you is if you're having an inadequate pelvis, if the size of your baby is larger than the orifice on your pelvis, is larger than the space on your pelvis. Remember I said it's a round bone. I will still attach the picture so you see what I'm talking about. So vaginal birth is also possible. Don't get scared that you may not be able to deliver your baby vaginally. Just check with your doctor, check with your midwife. They know what to do and they know the best option for you. Now, I mentioned that the cause is not specifically known, but there are some factors that contribute to this pelvic girdle pain. Number one is history of damage to the pelvis or injury to the pelvis. In a situation, maybe so a woman has been in an accident and they said the hip bone shifted, the pelvic bone shifted, any of the damage or injury to the pelvic bone is enough to give a woman pelvic girdle pain during pregnancy. Now, pelvic joint moving unevenly, weight and position of your baby, like I mentioned before, history of lower back pain. If you're somebody who had lower back pain before pregnancy, chances are that you will have pelvic girdle pain during pregnancy. Being overweight and having a physically demanding job is also a factor that can contribute to you having pelvic girdle pain. Like I said before, this pain affects 1 in 5 women. So it is advised that you cross-check with your doctor, check out for possible treatment options, and then stick with the advice your medical personnel, your trained medical personnel gave you, and you'll be very fine. You'll still deliver your baby safely and be happy, and the pain will go away, may go away after delivery. It may go away after delivery. So thank you so much for watching. If you love the video, please do like and subscribe, and also turn on your notification bell for further updates. Thank you and have a nice day.